have capacity and capability to be able to handle outbreaks and epidemics of this nature?
Good afternoon, and thank you for having me. So in order to actually ascertain whether a health system is capable of dealing with such an outbreak, we need to look at a range of conditions that a health system is supposed to be able to handle. This includes emergency care, conditions associated with lifestyle diseases, aging, maternity, and other associated support services and functions. So when you respond to an epidemic or a pandemic like COVID-19, that is not only, it doesn't only form part of a health system. You have all these other conditions. And when you look at our health system in South Africa, you see that we are overburdened and under-resourced. So we can't manage dealing with conditions that we know that exist, and let alone conditions that are unexpected, that require a response that is an unusual one, like how we are seeing now with COVID-19. So we have seen that we are struggling, we struggle. As we struggle with dealing with our day-to-day needs, our health system then cannot be termed as a capacitated system. It cannot be termed as one that is ready to deal with such a pandemic.
So outline for us, what are areas of struggle, and to what do you attribute that particular struggle?
Our areas of struggle include our health workforce. We don't have enough capacity with regards to that. We don't have enough nurses. We don't have enough doctors. We also don't have enough or efficient infrastructure in our health system. Another thing that contributes to a strong health system is one that has a good research and development sector, which is something that we also lack in. There are various other issues that we don't actually have that aren't working well. So a health system is well supported by other sectors, including sectors in water and sanitation, including nutrition, and things like that. So when you don't have these sectors supporting our health system, it also struggles with managing our day-to-day needs.
Now, the health minister and the National Health Department in particular has been lauded for how they have taken up this challenge of fighting COVID-19 and almost formed a single national public entity that is able to marshal private sector, civil society organizations, as well as private healthcare and public healthcare to work together towards a common goal. Is that some kind of a ray of hope that maybe sometime in the near future, and with an implementation of a reform like the NHI, if you view it that way, could possibly lead this country towards a better health system?
It's definitely commendable what the government has done thus far, and what needs to be done is the momentum needs to be kept even after we've passed this crisis, because what the issue is that we see now there's been quite decisive leadership, immediate action, but the momentum needs to continue post this crisis, because we still need to ensure that we have the infrastructure that will deal with our normal health conditions. We need to ensure that we have the resources so that when another crisis, or if another crisis were to hit, we don't have to run around looking for resources. We need to ensure that while we are not in crisis, we actually strengthen our health systems, ensuring that we can handle our daily needs, but also handle unexpected conditions in future.
Now, before this pandemic, of course, the health minister was pushing ahead, in fact, with the NHI. And he was listening, of course, to the critics, but saying even though there is criticism, but the system must go ahead because it seeks to address the structural imbalance, the inequality that exists between private healthcare and public healthcare. Now, looking at where we are right now as far as the process of NHI is concerned, do you see it being implemented anytime in the foreseeable future?
What I can say about the NHI is that we do need it as a country because our inequality means that the poorer communities do not get access to good health care. But as I said before, our health system is not equipped to actually disseminate the NHI in a way that is equitable, in a way that it actually will be effective. Without a health workforce that can actually work in an conducive environment, without the required infrastructure, without needing to actually, without having to focus on administrative tasks instead of actually dealing with the patient staff relationship, just introducing an NHI in the current system will mean that it will be ineffective. So I feel that we need to actually make sure that we fix our health system. We fix all the areas that need fixing, and then when you introduce an NHI, it will be more efficient in that way.
That was 1990 when we saw that HIV challenge that presented in the country, and how that continued to put strain on an already very fragile health system. How far off are we to implementing those fundamental critical reforms that would in some time in the future see us off in a better position to be able to implement NHI?
With the HIV epidemic, what really helped with making sure that we reduce the numbers of HIV infections were community health workers, because they came in and ensured that communities are informed about HIV, that communities know about ARVs, and they assisted in actually administrating antiretrovirals. They also made sure that people actually comply with taking the ARVs and such. So even with the NHI, it's part of strengthening the health system in making sure that the community health workers that are actually working right now, the employment is actually systematic and formalized, so that they actually assist in ensuring that the NHI is effective. So those are the things that actually really assisted with making sure that we have somewhat of a successful story when it comes to HIV.
Zamanzima, appreciate your time and thank you for joining us. Zamanzima Mazibuko, she is a